Hello, I'm Dr. Icilma Fergus, Associate Professor of Medicine at the Icahn School of Medicine at Mount Sinai Health Systems, also Director of Cardiovascular Disparities. I'm happy to be here with you today. So what do we mean by health disparities when it comes to heart health? A disparity means that the patient, as it relates to heart health, is not receiving equitable care because of something that is avoidable, that could be adjusted, that could be remedied, and should not be. And so eliminating disparities means to improve health equity and providing equal care for all. So when you look at cardiovascular care and outcomes here in the United States, you can see different outcomes for different groups. So you can see different outcomes for African Americans, Hispanics, other immigrants compared with the white population. And because there is adequate resources for all and great treatment for all, this is termed a disparity. Currently, you see that there are risk factors such as hypertension, diabetes, and obesity and other risk factors that are uncontrolled in certain populations, such as the African American population. What this means is that additional resources should be provided to ensure that those who are more needy are able to acquire the care that they need, that we address certain issues such as the social determinants of health, which includes health literacy, understanding of culture, providing access, and all of those different things to ensure that our patients are receiving the equitable care that they need and deserve. So what can be done is additional education that is geared towards certain populations. The term health literacy relates to the patient understanding about their medical condition and understanding what needs to be done in order to achieve equitable care. Sometimes the way that the medical jargon is delivered to patients, it may make them not only scared, but they may not even understand what to do. So at Mount Sinai, doing things such as providing patient literature that is geared towards the appropriate age, appropriate demographics, and appropriate language would be helpful. So therefore, translating literature into Spanish, into French, into other languages, as well as having it at a level that patients can understand would be important. Additionally, other resources such as providing education and screening for those in need will ensure that people are coming in to get care and to address issues that may be found while screening. We do know that heart disease is 80% preventable, which means that getting to the patient before the condition becomes almost uncurable or very complicated and difficult is important. Managing the risk factors earlier on and understanding the risk factors can, prevent the progression to an uncurable or complicated situation that invariably may end up in the patient's death or significant compromise or morbidity from heart health conditions. Mount Sinai is doing many things right now to educate patients and their families in communities. There are a number of programs. Mount Sinai Heart in particular has a diversity, equity, and inclusion program, which ensures that not only the staff that works at Mount Sinai, the diverse staff, but also the communities are aware of what's going on. Dr. Fuster has the program La Famiglia, which focuses on younger children early on in age, that they are impressionable and that could be coached and can receive education about preventative measures, things like eating healthy, exercising, drinking water instead of sugary drinks, and getting that message out early, because the whole concept is that kids are like sponges. If they receive all of the good information early, then they'll continue to do that later on in life. This program also focuses on getting the information to the providers for these children, so their parents, grandparents, or other extended family members who can ensure that the appropriate care is being taken of for these children. And there are a number of other programs, such as the one that I started in 2012, which is the Harlem Healthy Hearts, under the umbrella of the Healthy Heart series, where we do monthly workshops for people within the community talking about cardiovascular risk factors, what they are, how to manage them, how to treat them. We talk about understanding how to talk to your healthcare provider, your doctor, how to write things down, how to have a family member with you so that, or a friend, so that they can help you to remember the things that you need to remember that the doctor said to you, but also questions that you may have had that you forgot or too afraid to ask. Now, having someone with you can make that work. So we talk about that in the workshops, empower patients to be able to do this. We also talk to them about medication adherence. Some patients don't understand their medications. They may be afraid of them. And for that reason, they're not taking them. And they may not say anything to their healthcare provider. So in this program, we also talk about how to ask the questions about your medications, how to write down what the side effects are, and how to speak to the healthcare provider about alternative solutions to medications versus not taking them. And we also talk to the supermarkets and shopping centers within these underserved communities to ensure that healthier foods are upfront and present and available, such as fruit, vegetables, and water, versus the sugary drinks and processed foods. So the Healthy Heart of Harlem focuses on a number of different ways, which really results in patient education, patient management, and thus allowing the patient to engage in those behaviors and activities that would help to prevent a serious outcome from heart disease to occur. Well, for patients and consumers, again, and we're using the word consumers, you're a consumer of your health. When it comes to any other item or commodity that one is consuming or buying or taking in general, people ask questions. They ensure that they are satisfied, that they are receiving the care that they should. And the same goes for your health. You should be a healthy and happy consumer or patient when it comes to your health. Therefore, ensuring that you have a good rapport, a good one-on-one with your healthcare provider, whether it's a nurse practitioner or doctor or nurse, anyone within the healthcare field, that you have a good rapport, that you can ask questions, get your questions answered, and feel comfortable that you are getting the care that you deserve and need. That is very important. That I would say is number one. Mount Sinai provides a vast array of healthcare providers who are fluent in different languages, who are familiar with various cultures. If patients or participants go to the website, they can find a doctor or a healthcare provider who they feel that they can resonate with and who will help to take care of them to the way that they feel that they should. So be an educated consumer of not only everything else, but also of your health. And we at Mount Sinai are there to ensure that you are a healthy and happy consumer. A lot of it also comes from you yourself as far as what can be done to reduce your risk of heart disease. Therefore, managing your risk factors, knowing your numbers. So the low-hanging fruit are, of course, managing your blood pressure, following the guidelines of the American Heart Association and the American College of Cardiology, knowing that your blood pressure should be well controlled, ideally between 110 to 120 over 70 to 80. Going above these numbers, going above 130 over 90 will mean that you're starting to be in stage 1 of hypertension and should be managed. So managing your blood pressure, managing your blood sugar to mitigate the bad outcomes from diabetes. So eating right, watching your blood sugar, getting your finger sticks checked, taking your medications, very important. Getting enough exercise. The American Heart Association recommends exercising or getting physical activity on most days of the week for about 30 minutes. So ensure that you're doing that. And it doesn't necessarily mean an expensive gym membership. It could simply be walking, taking the stairs instead of taking the elevator, parking further away from the door of where you're going so that you're walking more. Ensuring that if you're sitting down on a lot of Zoom calls, as I'm doing right now, I know during the pandemic, a lot of people were sitting doing Zoom calls, but while sitting, you could be moving your feet, moving your legs, moving your arms. If you're not on camera, getting up and walking while, on the call will also be helpful. So we said managing your blood pressure, your blood sugar, getting enough physical activity, and how about managing your cholesterol numbers? So ensuring that you know what those numbers are, your total cholesterol, your good cholesterol or HDL, your bad cholesterol or LDL, and also the triglycerides. And now we as cardiologists, we're also focusing on another number called the lipoprotein A. So ensuring that you're aware that these numbers should be checked and that your healthcare providers are doing this. And finally, just simple things like, eating well, hydrating, getting enough sleep, ensuring that you follow up with your visits, being adherent to the medications, and then coming prepared with asking questions, reading up a bit about your own, condition, knowing your family history, and coming prepared when you come in to see your healthcare provider. The one thing that I could say about heart health, it is 80% preventable. So don't be afraid. Many conditions can be delayed or averted or minimized by following the recommendations, managing your risk factors and taking care of yourself. And even if there is a congenital, meaning something that you inherited, type of condition for the heart, it could be managed by reaching out to your healthcare providers very soon. The one message I can tell you also, because many of us are very busy these days, is to put on your own mask before trying to help others. In other words, many people are busy. They're taking care of family members, children, their parents, things at work, and then sometimes neglecting to take care of their own selves. But first, put on your mask, take care of yourself, listen to your body. If you don't feel right, there is maybe something going on, and that something could be taken care of. So listen to your body, listen to signals that may be given to you, and get yourself checked out. It's very easy to take care of yourself when you have heart disease if you follow the recommendations that I'm talking about, and that you could look at various websites such as the Mount Sinai Health Systems website or the American Heart Association, where we provide tips for you to help you with your heart health.